Welcome to Invest in Your Health. And Assalamu-Alaikum. Today, we're exploring the incredible world of kidney transplantation, a life-saving journey that combines medical expertise with human compassion. Let's dive in. Kidney transplantation is a life-saving medical procedure that requires the replacement of a non-functional kidney with a healthy one from a donor. This operation is often necessary for those with end-stage renal disease. The quality of life for the recipient can be significantly improved after a successful transplant, reducing the requirement for ongoing dialysis treatments. However, this procedure is complex and necessitates a carefully matched donor, a skilled surgical team, and a commitment to lifelong medication to prevent organ rejection. The identification of a suitable donor is an essential first step in the kidney transplantation process. Donors can be living or deceased, but the kidney must be compatible with the recipient's body. This means testing for blood type, tissue type, and other factors to ensure that the recipient's immune system will not reject the new organ. Living donors can be relatives, close friends, or even altruistic strangers. Deceased donors are individuals who have passed away but whose kidneys remain viable for transplantation. Living donors must meet specific criteria to be considered suitable for kidney donation. They must be in good overall health and free from conditions like diabetes, high blood pressure, or cancer, as these might affect kidney function. Additionally, donors must be mentally prepared for the surgical procedure and the emotional impact of donating a kidney. Age is also a factor, and donors typically must be between 18 and 70 years old, though this can vary depending on the medical facility. Deceased donors are usually individuals who have died from causes that do not affect their organs' functionality. The determination of brain death or cardiac death must be made by medical professionals following strict guidelines. The harvesting of organs must be done promptly to ensure that the kidneys remain viable for transplantation. Hospitals have specialized teams that handle the delicate process of organ recovery, preserving the organs in a way that maximizes their potential for successful transplantation. The evaluation process for both living and deceased donors is rigorous and extensive. For living donors, it includes a thorough examination of their medical history, physical health, and psychological readiness. Blood tests, imaging studies, and even counseling sessions are often part of this assessment. The goal is to ensure that the donor is physically capable of living with one kidney and psychologically prepared for the emotional aspects of donation. For recipients, the matching process with a donor is equally thorough. They are evaluated to ensure they are fit for surgery and post-operative care. Factors considered include age, overall health, and the likelihood of adhering to the lifelong medication regimen needed to prevent organ rejection. The matching process also considers the urgency of the recipient's need, the time spent waiting, and the availability of a compatible organ. The surgery for kidney transplantation is a complex and delicate process. The donor's kidney must be carefully removed and prepared for transplantation. The recipient's body must be ready to accept the new organ. This involves attaching the kidney to blood vessels and the urinary tract, a procedure requiring a highly skilled surgical team to ensure success. Post-operatively, recipients are closely monitored in specialized transplant units. Signs of rejection must be detected early, and the new kidney's function must be continuously assessed. Anti-rejection medications are administered to help the body accept the new organ. These medicines are vital and must be taken for the recipient's lifetime. Despite the complexity and potential risks of kidney transplantation, including the possibility of rejection or complications from medication, it remains the best option for many with end-stage renal disease. There are ongoing challenges, such as the shortage of available donor organs, which leads to long waiting lists. Public awareness campaigns and policies encouraging organ donation have been implemented to help address this issue. Ethical considerations play a vital role in kidney transplantation. Fairness in organ allocation, proper consent procedures for donors, and the costs associated with transplantation must all be handled with care, transparency, and respect for everyone involved. Continued research, medical innovation, and adherence to ethical principles are essential for the ongoing success of kidney transplantation. In conclusion, kidney transplantation is a multifaceted process, reliant on careful donor selection, skillful surgery, and committed post-operative care. Understanding the qualities and conditions required of a donor, whether living or deceased, is a vital part of this life-saving procedure. The compassionate generosity of donors and the diligent work of the medical community serve as a testament to the remarkable potential of kidney transplantation to save and improve lives. The journey from finding a suitable donor to post-surgery recovery is filled with medical intricacies, human connections, and profound opportunities for healing. Thank you for joining us on this enlightening exploration of kidney transplantation. We've journeyed through the intricate steps, from donor selection to the lifelong dedication that comes after surgery. If this video has touched you or sparked your curiosity, don't hesitate to share, like, and subscribe to Invest in Your Health.